So that was kind of my next question here then. Are there surgery options then for people who have epilepsy, or what are some maybe more advanced treatment options that you have?
We do have a lot of new anti-seizure drugs which are beyond the scope of our discussion today. Luckily, we do have a different mechanism of action, very powerful once daily medications. I'm going to skip all the names, but if somebody is on two appropriate anti-seizure drugs with the appropriate dosage, if they continue to have a breakthrough seizure, we call it a drug-resistant epilepsy. Unfortunately, certain type of seizure disorder, especially a focal onset with a generalized seizure, 30 to 40% of people have drug-resistant epilepsy. If they are already on two medication, adding a third medication, maybe 5 to 10% may get some reasonable seizure control. And if they don't have an appropriate seizure control with that, then we do have some neuromodulation therapies, technological therapies like Vagus Nerve Stimulator, which is, or VNS, which is like a small pacemaker-like device is inserted on the chest area with the lead wire that is wrapped around the vagal nerve, and it gives a continuous and intermittent stimulation. And the newer devices has the ability to detect based on the heart rate the patient is going to have a seizure. So it could give another auto stimulation to prevent that develop into a full-blown seizure. And patient also has a magnet or family can use if they see the patient having a seizure, they just swipe the magnet over to prevent it. It does have an additional 30 to 40% effect on refractory seizure. Then we do have a responsive nerve stimulation, which is a device that goes on top of the skull. That has to be done by a neurosurgeon. And the lead wire goes into the seizure focus. And the advantage of RNS is it concurrently records the EEG. And we have deep brain stimulation, which is again like a device goes into the chest area with the lead wire going into the thalamic area. So these are device or neuromodulation therapies. And epilepsy surgeries are, we do have different options depending upon the patient's seizure focus. It could be if they have a lesion like a vascular anomaly, or there is a structural abnormality, they do a lesionectomy. That particular part of the brain is removed. After extensive workup, make sure the patient's memory and language are preserved. So they have to undergo a battery of testing before we subject them to epilepsy surgery. And maybe brain mapping, stereo EEG to precisely locate where the seizure coming from. So lobectomy, they could actually remove the lobe, they could remove the lesion, and for generalized refractory seizures, callosotomy means like putting some holes in the connection part of the brain, or LIT. It is a laser interstitial thermal ablation, then radio ablation to the focus. So various surgical options are available. And with the appropriate surgery, there is almost 80% seizure control for certain type of seizures, which is amazing for patients with seizure, like 80% seizure control. And with the new AI technique, this neurosurgeons or stereo neurosurgeons are able to precisely put the leads even for that neuromodulation. So the surgical success is much better with the aid of the modern AI technologies. Yeah, it's a very exciting field in epilepsy. And then in the future, the medications are going to be very personalized medication. If we are able to find the genetic cause of the seizures, so we could personalize the therapies. That is the future of epilepsy treatment.